I think when you take a stand and you go into action, doors will open. Doors will open. It's that inertia that stops you. And once you either get mad enough or strong enough or determined enough and you move, it's physics, right? A body in motion stays in motion. A cause in motion stays in motion.
This is the Visible Voices podcast. I'm your host, Dr. Resa Lewiss. In today's episode, I speak with the Relentless school nurse. Yes, listeners, I am speaking with Robin Cogan. She is a nationally certified school nurse in her 24th year as a New Jersey school nurse in the Camden City School District. She writes a weekly blog, has a website, and calls herself the Relentless school nurse. Now, I first met Robin via Twitter, so I guess she's a friend from Twitter, or a fritter, as we call them. Robin writes all about school nursing and really has served as a source of information and education for me in terms of the comprehensive role that school nurses play. When we get to the conversation, we're doing a deep dive into school nursing and what about it truly is relentless. Robin Cogan, welcome to the Visible Voices podcast.
Thank you so much for having me, Resa. I'm looking forward to this conversation today.
People may know you, audience may have seen you on Twitter or on other social media channels as the Relentless school nurse. Being relentless is what it takes to lead change in nursing. Relentless school nursing calls us to expand our practice beyond the walls of our health offices and into the community. We understand the connection between home, school, and the health office. Relentless school nurses are leaders in their school communities. They are vigilant about safety, proactive about prevention, and called upon as a resource by those they serve.
You do your homework, Resa. Obviously, you're on my website, but you did a great job of pulling it all together. Yes, that's actually one of the reasons I started my blog 8 years ago now. And I do believe everything I've written, and I have now a legion of other relentless school nurses who often look to my blog for maybe what's happening in school nursing, in society. I've taken on some pretty major issues. Most recently, I published a blog post about the attempted assassination on the former president and what that means in terms of gun violence and gun violence prevention. So yes, I am relentless, and I have other relentless school nurses across the country who follow that thought that that's what we need to be effective.
When you and I first started speaking, you asked how I came to you, how I found you. And it really was a pandemic phenomenon of seeing who was on social media. And I started following certain people. And I really was awakened to the role of school nurses, not just during the pandemic. But I think most people listening to our conversation today could think and say, you know what, I remember my school nurse. I have very clear visions, specifically elementary school, of my school nurse. I remember being checked, a tongue depressor being put in my mouth. I think we had head checks at some point. And I remember going to her when I had a stomach ache. I remember my elementary school nurse. And I think, again, most people will have this recall. What I've been humbled by, that for which I have a lot of respect, is all that school nurses do. And I credit you to really bringing that attention to people, and your chock full of information website really can provide more information that people that do want to now learn more, read more, hear more. You're concluding your 23rd year as a school nurse, 39 years in total as a nurse.
Yes. More than half of my professional career has been in school nursing, which I came to on a circuitous route, like most of my education. And I'm very thankful I ended up in school nursing. It was never my plan. And I also had no idea what school nurses really did. And I think that's one of the ironies of all of this, that even within nursing, because if you remember, almost half of my career had gone by before I became a school nurse, I had no idea the scope of practice, the incredible responsibilities on our shoulders solo. We're independent practitioners. And so I was working in occupational health for a railroad, and I had done a lot of case management and other things. Anyway, kind of the rug got pulled out from under all of us when they sold the railroad, and I was not about to relocate my entire very young family. And so I took a sabbatical and just a few months off to figure out what I was going to do next. And my children, my twins at the time, wanted to go to overnight camp. So we packed up and went to overnight camp, and everyone there was a school nurse. And I thought, oh, that sounds like a good idea. Actually, camp nursing is a great background to see if you want to be a school nurse, because at camp, kids live with you. They don't go home when they're sick like they do at school. So anyway, that's how I came into school nursing, by the positive influence from these amazing school nurses that I spent the summer with.
When you've described the role, the many roles, the many hats that a school nurse wears, some I was aware of, some I was not aware of. And you have described a school nurse as the chief wellness officer of the school. And I really like that descriptor. Also, when we think about social determinants of health, only 75% of schools actually have a nurse, or flip that, 25% of schools have no school nurse. You don't know what is going to come in the door. It could be anaphylaxis. It could be, I have to take my daily medications. It could be responding to an active shooter. It could be something in a classroom, but often it's actually outside the building in a parking lot. And it struck me that there is a Venn diagram overlap of a school nurse and an emergency physician.
There's many similarities because we never know what's happening day to day. I always say that our true work is what interrupts us. It's not what we have planned in a day, right? And so in school nursing, much like in emergency medicine, we don't know what's going to happen. You can predict certain things may be happening at given hours, given times of the year, but every day is rather unpredictable because you don't know. I think the big difference, though, is you have a team around you and we don't. And you have amazing resources and equipment, and we're really working like in a MASH unit almost. So while we have Narcan now, and we have stock epinephrine, and we have oxygen and stop the bleed kits in some districts, certainly we have AEDs in all of our training, we are independent practitioners in a building.
Is it scary?
There are absolutely times when it is really scary. And I think one of the downsides, there's many upsides, but one of the downsides is, and this happens in hospitals too, we don't have enough time to debrief, to decompress, to process the really scary moments. We just have to move on. There could be 10 more kids waiting for us after an emergency happens, and we just have to move on and keep going. And so just like in healthcare, that is certainly something that they've addressed. Now many hospitals implement the pause after a death or after a very traumatic event. We don't do that at school. We could do that individually as school nurses, but we don't typically have a partner to do that with. I did want to go back to the chief wellness officer concept because that's who we are in our buildings. We are the chief wellness officer. I speak about this, I write about this, I teach about this because I believe that when we take on that title, it changes how we look at our practice. We have to actually give ourselves a promotion because sadly in school nursing, there's not a lot of room for upward mobility. So in my experience, I've learned to grow horizontally because truthfully, if I've had the same exact job for 24 years. And so what I've done is I've grown a blog. I speak and write and get involved in gun violence prevention advocacy, which has led to some amazing opportunities. But, a typical day-to-day experience could become very stale very quickly if there's no room for upward mobility. And so that's when I started this push to encourage school nurses to think of themselves as the chief wellness officer, because that really is who we are. And there should be a pathway to that level of acknowledgement of our expertise. There's certainly, I know in my district, there's a chief of talent, which is the HR person. There's chief of schools. There's many, many chiefs. So where is the chief wellness officer?
I like that very much. And I also hear that in terms of being a visible voice. And I'm sold. I'm sold on the role school nurses play. And what I'll call out and say is a lack of appreciation. And we're going to get to that in a minute. But first, let's go down the pathway of gun violence and gun violence prevention. I have read your writings. I have listened to you on other podcasts. And for you, gun violence is personal. And I'm wondering if you can briefly tell the story of perhaps a bit of inherited trauma regarding gun violence, current familial exposure in terms of gun violence, as well as your own role as a school nurse. So I'm wondering if you can share with the audience more about what contributes to who you are in terms of one who feels very strongly about gun violence prevention.
Yes, absolutely. You make a really good point about it being personal and professional. And I do find that many, especially healthcare professionals who work in gun violence prevention, research in the field, they typically have a tie to a family member, a story, a personal experience, or something really dramatic, devastating that's happened through their professional work. And in my case, it's definitely both. My father, very tragically, and probably one of the first mass shootings in America, was 12 years old in 1949 in Camden, the very city where I have been spending many decades of my school nursing career. His entire family was murdered by a neighbor, his mother, his father, his grandmother, 10 other neighbors, so 13 people. 3 were injured in 1949. My father went on to live a successful life. I mean, you could absolutely say that he rose from the ashes of that horrific tragedy. Not that it didn't impact him, because it significantly impacted him emotionally. It took a terrible emotional toll on him in a kind of twist of fate, or I don't know what else to call it. My father named me for his parents. And so I feel like that legacy was a hard burden to bear for many years. Now I have embraced it as really something to honor. But when I found out their life story, it was pretty traumatic to know that I was then named for them. But anyway, my dad went on to get married very young, have a family very young, and really lived his life to keep the legacy of his family not just alive, but he wanted to make them proud. And that was the message that he gave us. He was very protective about what happened to him, but he was a very traumatized person. And again, when he was 12 years old in 1949, there was no bereavement groups, there were no support groups. He was sent to live with family member to family member to family member, eventually putting himself into military school, if you could imagine. And so he married at 21. He had children immediately, very young family. My mother's only 20 years older than I am. He lived a good life, but it deeply impacted him because he kept it inside until he had a very important reason to talk about it. So he was not necessarily a gun violence advocate initially in his life. But in the early 80s, there was a public defender who took on the case of the killer. And I was 20. I had just met my husband. In fact, the first time my husband saw my father, my dad was on television. And he was a man who had never spoken out. He was very secretive. He didn't want people to know. Like many people of that generation, it was secret.
Don't talk about it.
Don't talk about it. Don't let anyone know. It's a family secret. Anyway, my father then became the opposite. Then he wouldn't stop talking. He became quite the activist. So anyway, my father then became quite an activist, and I watched very closely. I went to court with him. I saw the killer. We sat there year after year while that killer was given more and more freedom. And my father would always say, my parents and my grandmother had no ability to have freedom. When I go to visit them, I have to go to their grave. And so tragically and almost unbelievably, my father was buried on the 60th anniversary of the murders. It just showed me how much he kept inside. I feel like I learned a lot about trauma much more after my father died than while he was alive. I think I understood him a lot more after he died because his trauma he kept it so deeply buried inside that he would have nightmares frequently, but he wouldn't really ever talk about things. He was focused on our safety, and he was focused on not having assault weapons on the streets. And he would speak to college classes. Like, he really turned the opposite from being very closed to being incredibly open. But even those many decades later, the damage was already done to his body because my father died of a hemorrhagic stroke. And it's almost like his brain imploded. That's what it felt like. And also the timing of that, it was not lost on us that I'm giving his eulogy on the day that, all of this happened, 60 years to the day. But then, unbelievably, almost 18 years later, he had already passed away. My niece was a Parkland student. So in Valentine's Day 2018, my niece found herself hiding in a closet, much like my father did, to keep away from an active shooter. Thankfully, she was not in the building where the shootings occurred, but like everyone in that community, they were touched. She knew people. I sat on the phone with my sister for hours and hours after Parkland. She was standing behind, the yellow tape that we've all now come to be only so familiar with. And that's when I thought, this is one family, 2 mass shootings over 3 generations. I can't just sit back and watch this as I work in the same community where my father's, shooting happened.
It's remarkable. And these are this sort of personal circumstances that drive what we do professionally. So for audience members that aren't familiar with your work now with firearm prevention and even your recent visit to the White House, fill us in.
Yes. So that's when I promised to my sister, myself, really, my father, who was no longer with us, and my niece, that I was going to spend the rest of my career working on gun violence prevention from a public health perspective, because I saw for decades that the police angle is very important, but it is not prevention. It is reaction. And you can see even Saturday, you see that there was no prevention involved in what happened Saturday night, but yet there are so many chances probably to intercede. And this pattern repeats itself over and over again.
I ask my guests, when did you realize you had a voice? When did you start using your voice? And I think that's what you just shared.
Yeah, for sure. Because right before this happened is when I started my blog. And my blog initially was all about school nursing and focusing on what happened in our offices and the scope of our practice and what other school nurses were doing. But that's when my blog became much more about taking on really critical issues in this country that also impact children. And certainly school gun violence since then, especially, since Columbine has risen. But in the last 5 years, it's also risen exponentially. And so, yes, I was invited to the White House. That was quite a watershed moment for me, for school nurses too, though, to have us present at the table, having these conversations, being invited into spaces because of people like Peter Masiokas from Mass General Hospital's Gun Violence Prevention Center, who's been incredibly professionally and personally generous to me, opening doors for writing, for speaking. Joe Saccharin inviting me into his work at the Brady Foundation, which, I'm thrilled to be there because I know how much my father really appreciated the work that they were doing.
I want to pick up on a piece that you dropped about healthcare design related decision making and having the right end users, the people affected at the table. And though you recently made this visit to the White House and are being invited to tables, there was a policy that came out, and this was actually a policy on gun violence, shooting schools. And incredibly, surprisingly, ridiculously, school nurses weren't at the table when that policy was being written. Can you tell us about that?
Yeah, there was a phenomenal policy that the Department of Education released in conjunction with the White House to recommend to all principals and superintendents that gun safe storage, firearm safe storage, should be taught at school. This is something schools should take on resolutions, that they will be teaching this at school, that they will be sharing this information with parents. And school nurses were not included in that discussion, which really was an oversight, but one that happens much too often, which is why we do need to be that chief wellness officer because we need to be at that table. Some of us were at the table during COVID. Many of us were not. That was a perfect example of when we were saying things that maybe schools felt we were following the science and following the recommendations. They were getting tremendous pushback from parents. And so they then gave pushback to the nurses.
Why do you think that school nurses are overlooked so often on so many issues?
My original belief was there was a fundamental lack of understanding of the scope of our role. I can't say that that's true anymore because if you don't know the scope of a school nurse's role during COVID, then you don't either have a school nurse in your building, and that is a huge problem, or you've never had an emergency, which I highly doubt, that you needed a medical person on site. So I think it's way too easy to look at the educational world and say, well, this nurse doesn't really fit into our system. We're in two different ecosystems when really we're not at all. We're speaking the same language, which is children being safe, healthy, and able to learn and flourish at school. And so some of it is we've always done it this way, which you know is always a problem when that is the party line. Well, this is how we've always done it. That's a red flag for, well, then you have a huge problem on your hands. And much of it is that there hasn't been recognition about leadership in school nursing, that we need to be in those leadership roles at the highest level of decision making. Instead of begging for these things, they should be listening to our recommendations. They are evidence-based. We are not whining and complaining. We're telling you that this is what we're seeing. This is what we have the capacity to do. This is what our students need.
I would be remiss if I didn't bring up mental health and the percent of children that come to you, and a part of the care you're providing or the triaging you're doing is mental health related.
Right. So, well, I have to tell you that prior to COVID, 34% of our visits were mental health. That was before COVID. And now it's much higher. There's a study going on right now to really get some numbers behind that. I would say it's more than 50%. And part of that is this sense of not feeling safe. You know, there is a real sense of concern. It's not only about a school shooter. We're also doing active shooter drills in 95% of our schools on a regular basis. We are drilling for things that probably won't happen in classrooms where most active shooters are coming from the outside into buildings. It's like 60 or 70% of all shootings are in parking lots. They're not necessarily within the building itself. Yes, the big ones, Uvalde, absolutely. But even Parkland, there were shootings actually in classrooms. That's true. But a lot of people were also shot in hallways because of how that person understood what the active shooter drill looked like and took advantage of what he knew. And so that's another issue around active shooter drills. When most of the school shooters are actually prior students or current students, or students like in Parkland who was expelled from school, they know what we're drilling for. So why are we doing it? It's not evidence-based. I have to be really careful when we begin to tie mental health to school shootings. I really want to separate that because most people with mental health issues are victims. They are not the perpetrators. However, being exposed to school gun violence, to community gun violence, to violence in general will impact all of our mental health for sure. So there's a fine line there.
I have a sense, and also I'm going to ask, what keeps you up at night?
Gosh, day to day, there's been many things keeping me up at night for a long time now. The direction that our country is going in really keeps me up at night. I'm really worried about this next generation. I happen to be a new grandmom, and thinking about that little granddaughter keeps me up at night. What have we done? What are we leaving to this next generation, these babies who are counting on us to take care of our environment, which we haven't, to take care of safety in America, which we haven't, to take care of the trauma of living in poverty, which we haven't, racism, which we haven't. And so those things really do keep me up at night. I worry about the future of my colleagues. I worry about school nurses. I'm really concerned about our own mental health. And can we sustain this ongoing caseload that many of us have that is pretty untenable? And yet we're trying every day to make sure people are safe and well and okay to be in school. And we often get quite a bit of pushback.
Robin Cogan, you are a visible voice. For audience members that want to know how to get in touch with you, where to find you, and to learn more about your work, where would you send them?
Oh, what a nice opportunity to share my social media. So you can reach me at relentlessschoolnurse@gmail.com. I love getting emails from people, but please be nice. Although I can take constructive criticism. I have a blog called Relentless School Nurse, so it's relentlessschoolnurse.com. And I write under my name at Robin Cogan on Twitter. I still do Twitter. I think it's an important place for me to be with like-minded colleagues. I do not engage in nastiness. I'll just block people. And I'm also present on Facebook and LinkedIn.
And you are available for consultation and speaking engagements.
Yes, I am. Thanks for bringing that up.
Thank you, Robin.
Thank you so much. This has really been a great discussion. I so appreciate you reaching out and finding me, and I'm looking forward to our paths continuing to cross.
The Resa Wrap-Up. Special thanks to Robin Cogan for joining me in conversation. A very, very delightful, informative, inspiring, educational conversation. Okay, listeners, number 1, school nursing and emergency medicine. Quite similar in that you never know what's going to happen. You never know what your day will bring. You don't know what will come through the door. However, a big, big, big difference. School nurses do not have a team and do not have the resources that we have in the emergency department. Number 2, 25%. Can you believe that 25% of schools in this country do not even have a school nurse? They don't have a chief wellness officer. Now, this is a clear relation in my mind to social determinants of health. What exactly are social determinants of health? This refers to where we learn, where we pray, where we work, where we sleep, and therefore where we access healthcare. And that access in and of itself plays a role in how long we live and the quality of that time during which we live. Finally, relentless school nursing. It should not be relentless. This should not be what it takes to have a voice at the table, to be the healthcare designer, to help make schools safer and society better for all of our children. That's all I have for you this week, audience. See you next time. The Visible Voices podcast amplifies voices in the healthcare, equity, and current trend spaces. We are a production of the People's Media Network. Our team includes Dr. Giuliano DePortu and me, Dr. Resa Lewiss. Please find me through my website and on social media, Resa Lewiss MD, or through the podcast, thevisiblevoicespodcast.com. Please give us a 5-star rating on Apple or wherever you listen to podcasts. Also, please be sure to share the show with a friend. The views and opinions expressed by the host and guests are their own and do not necessarily reflect the opinion of the institution with which they are affiliated or identified. Information herein should never be used as a substitute for clinical judgment or for medical advice.